Hi, this is Mike Estrada, Rescue Team Supervisor with American Ambulance. I'm here to talk about back injury prevention. The most significant injury to EMS professionals are back injuries. It is estimated that 1 in 4 EMS professionals will encounter a back injury within the first 4 years of employment. Injuries are related to poor lifting techniques and excessive force on the lower back while moving or lifting a patient. Most injuries occur during lateral transfer. If the patient is unable to move on their own, you will need the following equipment. The first is a blue transfer device for patients up to 250 pounds. It has 4 handles to facilitate the transfer for you and your partner. This device will be available in all ALS units. If the patient is over 250 pounds, you should be requesting a BLS unit to assist you. BLS units will have a larger transfer device with 8 handles, so that all 4 of you can work together to ensure a safe transfer. A third transfer device will also be available on BLS units. It is yellow and black and intended to facilitate sliding a patient from bed to bed. Remember, patients over 500 pounds will require a bariatric unit, equipped with a bariatric gurney, lift, and other specialized equipment. Position the transfer device and portable slider sheet under the patient. First, explain to the patient what you are going to be doing, and on a count of 3, log roll them, working together. Align the transfer device at the top of the patient's shoulders, extending all the way down, ensuring that you're covering the patient's torso. You will want the logo or seamless side face down. The slider sheet is simply a piece of plastic to help the patient slide more easily from bed to gurney. Utilize help from hospital staff when at all possible. When positioning the transfer device, be sure to leave enough material so that the person pulling does not have to lean too far over. Before moving the patient, make sure you get in the right position. You want your knees bent and feet off-center, hinging your back at the hip with arms extended and holding onto the handles. Being in the right position will reduce the force and strain on your lower back. If you bend at the back and reach over the bed, you will increase the strain on your back by 10 to 1. As a team, gently slide the patient across the bed onto the gurney. Don't lift, only push or pull. Remember, pushing or pulling reduces the strain on your back and shoulders. Some people have not used the plastic sheets because the patient slips while on the gurney. To avoid the patient slipping, make sure you use the shoulder straps or simply remove the plastic sheet. Please do not leave the device at the hospital. Back injuries affect EMS professionals regardless of age, gender, or experience. Using the patient transfer device and the portable slider sheet will help reduce back injuries.
In order to safely move a patient, for one, you want to make sure that you have everything on board, like fully cast, like all the cords are disconnected, like everything is done before you move the patient, and that like no sheets are stuck or anything like that, because that could be a safety hazard.
Another thing to look into is making sure you have enough hands to move the patient. If you have a patient that's overweight, it's always good to ask for more hands. Don't try to be a superhero and be like, I got this. So that's always a good thing because you're back, safety first.
Make sure you remind the patient, not to reach or grab for anything, to just kind of give themselves a hug and just hold on and be patient.
So we always put on gloves right before we move the patient. Always make sure the patient's ready to go. I don't want anything on them that shouldn't be on them. Make sure everything's clear.
Something that makes it really difficult to move the patient is when you don't lock the bed before you move them, and you move them and then like everything rolls with you and you're like falling over and trying to make sure you don't drop the patient.
Another thing is if you're not on the same page with your partner, sometimes your partner won't count to 3, but you're the person that likes to count, and so they move and you're not ready. So that's kind of difficult, and it's also dangerous because you guys aren't on the same page. So just making sure you and your partner are on the same page really helps.
When the patient's in a lot of pain, it makes it really difficult to move them because you don't want to cause them, more harm.
If they're hurting and you start moving, and they're like stop, and you're in an awkward position, then that's really bad because you're like, oh, I don't know what to do right now. Because they're hurting and you don't want to make it worse, but you're also in a weird position, so that's also very dangerous. So just keep in mind to make sure that you know everything that's going on before you move this patient and you have enough room to move this patient. So situations like that come into my head when I think about difficulty and dangerous times, is little things like that. So
Thanks for watching this video. Stay safe out there.